everyone. My name is Dr. Lina from Dental101. Today, we are going to have a short but very valuable video about some strategies that you can use to communicate with your patient or your examiner in an OSCE communication role play. You know that during the practical examination, you are going to have some stations that are pretty much about how you communicate and give information to a patient. So definitely we think it's important for you to remember just some bullet points that are going to help you stay in the zone and try to communicate in a better manner with your patient. So first of all, I will say you need to read the case that is in front of you. We have stressed in this point a lot over a long period of time. Sometimes we don't read because reading is going to give you the context so you can start the conversation with the patient. Therefore, if you are seeing a case where it says that the patient is new to you or to your practice, you should be able to start by introducing yourself. Hi, John. Hi, Mrs. Jane. Hi, Mr. Andrews. My name is Lina. I will be your dentist today. There's no specific way to introduce yourself. Just try to be natural and try to do it as you will do it in a real situation with a real patient. Hello, Mrs. John or Mr. John. What brings you here today? What can I do for you today? So just try to be aware if you actually need to introduce yourself so you can take that from the scenario that is playing on the screen, or if definitely this is a recurrent patient that you have seen before, exactly what you will do in a real situation. Hey, Mrs. Lina, nice to see you again. Tell me what has changed so far, or tell me what brings you here again today. I remember that I saw you a year ago, a month ago, or we finished last week the treatment. How is everything going? So remember, context is very important in order for you not to sound weird. That's one of the things that I think at the beginning we struggle a lot with because we don't know how to just break the ice and start the case. But I will say context is the thing that is going to save you in this particular situation. After you have started the case, either by introducing yourself or greeting your patient again, then we need to keep in account how should we respond to the patient's feelings. That's quite important in these cases as well, because some patients are going to have some ideas of what is going on to them and how they are dealing with the thing as well. So we need to be able and prepare and be prepared as well to respond to those feelings. So I think the most important thing here will be use confirming or affirming statements and positive tones. And here, um, for example, I can see that you look overwhelmed by this situation or of this information. If the patient says, I'm really worried, about the state of my teeth, they are looking terrible. You can also say, you seem worried about your oral health. That's another important thing in there. The patient, it's telling you that he thinks that the situation is presenting because he is not very good flossing, or he or she is not very good with the brushing. And you can say, I really value that you are having some kind of input with this particular situation. It's clear to me that you are concerned about your health, you know or if the patient says, like, I'm here ready to start with my treatment and do my thing. I like the positive attitude that you are showing. That's also another important thing that you can definitely throw in there, just to reassure the patient and the examiner. Remember that in real life, especially here in Australia, we want just to create that environment where the patient feels secure to express what he thinks or she thinks. Obviously, like in every situation, even in real life, the use of nonverbal communication is also quite important. So eye contact is important. I know that during your OSCE, you are going to have the time to do some notes. And sometimes we just like to refer to those notes just to follow our key points and not to forget anything. But this cannot be the center of your focus. You need to make eye contact with your examiner in order for them to feel that you are having actually a real conversation and not just a simulation. Head nodding, when the patient says something, if you don't want to reply by saying anything, you can say, yeah, nod your head, and that's going to tell them that you are following the line of conversation. Leaning forward sometimes means that you are very interested about what a particular person is saying. So if you just come a little bit closer just to try to understand and nod your head, head, they will understand that you definitely are very interested in that conversation. It's important to be non-judgmental. Happens a lot when you ask the patient the question of a smoking habit, for example. Are you a smoker? And the patient feels ashamed and he's like, or she's like, yeah, I'm a smoker. I mean, your role there is not to judge why the patient is smoking or why the patient hasn't quit smoking. Your role there is pretty much about how the smoking habit is going to affect the outcome of any possible treatment. And that's why you need to communicate to the patient. So that part is very, very important, not to judge. Um, Also happens when with oral hygiene habits, for example. We know that flossing is something that some people struggle with because they think it's hard, or they think that's time consuming and they don't have time. So when we ask, do you floss, and the patient is like, oh well, not really, I'm not a flosser, the patient feels a little bit ashamed. But what you need to say is, that's okay. Maybe we can come to an agreement. Can you do that once every week or twice every week? And you can even show to the patients how to do the flossing. That way you remove the judgmental part of the situation and the patient feels more comfortable. Also, we want to show empathy and support. So if the patient says, I'm having a terrible pain since 3 days ago, I'm sorry to hear that you're having that pain. Sometimes if any particular phrase sounds a little bit rehearsed or fake, you can make up your own statement, and that's going to be okay as well. So if you feel that saying, I'm so sorry that you are going through that pain, sounds a little bit not too natural, probably you can say to the patient, yeah, I can imagine how terrible that pain must be. I mean, you are not able to sleep, poor thing. You can make up your own statement just to try to empathize with the patient's feelings. That's another important thing to keep in mind in there. Another thing, check that if the patient is following you. That's extremely important, especially in your exam, because sometimes when we start talking, we are so focused on delivering all that information that we forget that we have to communicate with someone across ourselves. So you need to pause. You can even strategize where to pause. I mean, it's not that you need to do that randomly. If you have rehearsed a particular case and the structure is similar in the exam to the case that you have rehearsed, and you know that you want to first explain to the patient signs and symptoms, then you explain that and you pause and you ask the patient, is that clear for you, Mrs. Lina or Mr. David? And if the patient says, yes, it's all clear, then you continue with the following thing. That will be the pathophysiology and the diagnosis. And then you pause again. And then you check with the patient again. So is it clear for you, Mrs. Lina, what I'm telling you? So basically, the pathology or the condition that you have right now, it's called this, and it's basically this and that. And you explain your diagnosis. And if the patient has understood you, the patient will say yes. And then you can move on to treatment options, if that's what is required of the case. But checking with the patient, it is quite important because we cannot forget that this is a conversation that needs to look natural. Another important thing with the communication is not to use jargons. I think the only moment that you are going to use a scientific term is, for example, in a diagnosis and management case, because you actually need to deliver that name. But make sure that either you explain first and then give the name, or give the name and then explain it. For example, so what is happening here, Mrs. Lina, is that your nerve or the nerve inside of the tooth is badly inflamed. Since the nerve is badly inflamed, because the decay is very deep, there's no other way for us to treat that rather than treating the nerve itself. That is what we know as irreversible pulpitis. So you have explained first and then you have given the name because you have to, but then the patient is going to be, oh, okay, yeah, I understand what is happening. Or you can do it the other way around. What I can see is happening with your tooth is something that we call irreversible pulpitis, Mrs. Lina, which is pretty much the fancy or scientific name to say that the nerve is already too inflamed that we cannot, or the nerve cannot recover it. And then we need to think about probably do some kind of nerve treatment. So that way, yes, you are using jargon, but you are explaining, which is quite important in there. If you have x-rays, if you have images, just use them. I think that's quite valuable in OSCE cases, because if you are able just to point to the screen or even stand up and point into the screen to explain a specific x-ray, that's very useful, because sometimes, explaining just with hands and words what you are seeing on the x-ray is quite hard. So make sure that if you have those resources available in there, for because the case has it, just use them. And I think that's pretty much a good summary of how to keep a very good conversation, how to keep your examiner or so-called patient engaged while you are doing an OSCE communication. I think if you keep that in mind, you can apply that to every single OSCE that you want to attempt. It's general, knowledge that these things help you go through a communication or a conversation that needs to feel natural. And again, as a last tip, remember, doesn't matter how many times you have rehearsed or seen a case, you need to read very carefully the question that you have in front of you so you can establish the context, and the start of the case could be a little bit more easy and smooth. So thank you guys for watching us. Stay tuned with us so we can give you more tips and more suggestions for your ADC practical examination. Have a lovely day. Bye.